Hi, my name is Tammy Kenhan. I was born in Miami, Florida. I was born in 1974. On my free time, I love to enjoy all the beautiful sights we have here in the city, especially being on the water. I live with my husband and my two kids. I have two teenagers. We have a boat and we love going to the Florida Keys. So anything that's water related, my family and I enjoy to do that on our free time. I am a pharmaceutical rep and I'm in the oncology division. 10 years ago, I was diagnosed with breast cancer. Before that diagnosis, I was healthy. I had two kids, ages of 4 and 6. But being that I worked in the industry, I was very proactive on my pre-screenings and just staying on top of my health. And at the age of 35, I decided that I wanted to get a baseline mammogram. Once I did that baseline mammogram, I returned at the age of 36.
When she went in for her follow-up mammogram, she was found to have an abnormality, had a biopsy that showed some atypical cells, and had gone to a couple of institutions and received some opinions and decided to come and see us. And in reviewing her studies, I felt that she warranted further imaging, including an MRI. When we proceeded with the MRI of the breast, we then found an additional area that was biopsied and that did show a cancer.
I am so grateful that I had that third opinion with Dr. Giron. I can honestly say that she pretty much saved my life. No one had offered the MRI before her.
She is a case of early detection with screening. She was completely asymptomatic. Had it not been for that imaging study, we would not have diagnosed her at that time.
When I first met Dr. Giron, it was an instant connection. She grabbed my hands, she looked at me in the eyes, and she told me, I know you're scared, and I know you think, this is a terrible thing that's happening to you, but you're gonna be fine.
Her disease was early stage. We proceeded with surgery. She was not a candidate for chemotherapy. There was no role for radiation therapy either.
She did say that afterwards I would be put on tamoxifen for 5 years.
And the minute that she completed her treatment, all she wanted to do was give back and let people in the community know. I am very honored to have been her physician during all of this time. Tammy is a real inspiration.
I feel great. So different from when I was first diagnosed. I was fearful. I didn't know what my future was gonna hold. Am I not gonna see them grow up? 10 years out now, I've reevaluated a lot of things in my life. Just waking up is a celebration and being healthy.
So over the last decade, we've had a lot of technical advances. Clearly, our imaging is much better than it used to be. We have a 3D mammography. Our ultrasound machines are more sophisticated, our MRIs as well. The world of genetics has really expanded. The process of reconstruction has evolved as well. And I think that the most important thing to look at when looking at treatment for breast cancer now versus 10, 20 years ago would be that it's very personalized.
The benefit that women have now with Miami Cancer Institute that I didn't have, all of these offerings are here for these patients in one location. Now having a daughter, I assured her that we would do the testing, when the time is right for her.
My mom was very proactive, and I want to follow in her footsteps and do the same. When I get to the certain recommended age, maybe go a little bit earlier, just to make sure that I am on top of my health. Knowing that my mom had cancer definitely did make me see her in a different light. It made me realize just how strong she was. She was still able to be there for me during that time. She is also my #1 supporter, my best friend, my go-to person for advice, especially through the difficult teenage years. I could not imagine going through this without my mom by my side. Wow, my mom is just a powerful woman.
I would encourage women to proceed with their yearly screening mammograms starting at age 40. And do not hesitate to go and see your gynecologist. Do not ignore symptoms that are worrying you.
There's, the possibility for survivorship and cure. Look at me, I'm 10 years out.